The following is a podcast from a qualified senior care provider heard on the Answers for Elders radio show.
And welcome everyone to Answers for Elders Radio Network. And on this very lucky St. Paddy's Day weekend, we are coming to you from Greater Puget Sound across the United States. And we're so thrilled to be in 19 markets here in the US. And we are here to share all kinds of issues that affect seniors today. And I think one of the things that's really been interesting is we've been hearing a lot of things in the news about Medicare. What is going to happen in the future? There's all kinds of things going on. And so I was very much looking forward to having this guest back on my show. She was on a while ago. And we are here to introduce Kristine Grow, and she is the spokesperson for the Coalition of Medicare Choices. And we're going to talk all about Medicare Advantage, what her organization does. And Kristine, welcome to Answers for Elders.
Thank you so much for having me.
Kristine, you are, your organization really is kind of a watchdog, I would say, for Medicare. You help to make sure that the strength of Medicare is preserved, so that people like seniors, there's a lot of fear out there right now with, in the world of Washington, D.C., that there may be people trying to take away these programs that were, once we turn 65. So tell us a little bit. There's Medicare, and then you turn 65 and you have to enroll in Medicare. And whether you're on other insurance or not, you still have to enroll. But the thing that my question is then there's Medicare Advantage programs and there's Medicare supplemental programs. First of all, what is Medicare Advantage? Because I think that's something that maybe a lot of people don't know the difference of.
Sure. Thank you very much for the question. So when you become eligible for Medicare, you have choices into what kinds of healthcare coverage you can enroll in. Original Medicare are the parts that are considered Medicare Part A and Medicare Part B.
Mm-hmm.
Part A covers a chunk of hospitalization costs. Medicare Part B covers a chunk of doctor visits and other similar sorts of visits. Medicare Advantage is Medicare Part C. And Medicare Advantage covers everything that original Medicare covers, plus a whole lot more. So if you enroll both Parts A and B, you can also choose Part C. Some of the benefits that we hear from our seniors who are part of the Coalition for Medicare Choices about what they really like about Medicare Advantage is the vast majority of these plans include prescription drug coverage. I think a lot of Americans are surprised when they hear that original Medicare doesn't include prescription drug coverage.
Yeah.
It also includes services like dental, vision, and hearing services, which are very important, different parts of your health that are very important, especially as we age. Other services include coordination of care, particularly for conditions that are chronic conditions, such as if you have heart disease or a heart condition, if you have diabetes. These are very common kinds of health conditions that, if you proactively manage them, you can stay healthier a little bit longer and realize and achieve a better quality of life than you may otherwise. There are also more benefits in Medicare Advantage that are being included now, which are called supplemental benefits. And these are benefits to address what are called the social determinants of health or social barriers to better health.
Sure.
So for example, if you have a home that doesn't have very good air conditioning or heating, and you have some health risks, you may be able to get additional services to help you keep your cold place warmer or your warm place a little bit cooler. You may get transportation back and forth to the doctor's office or to the pharmacy to get the care that you need, even healthy foods and healthy meal programs if that is a risk factor for you. So there's a lot that these Medicare Advantage programs offer beyond original Medicare.
Yeah. Kristine, I know for me, I turned 65 now. I'm going to be 67 here. I can't believe it, but
congratulations.
But the thing is I found it very confusing. And I think even as much as I know about my industry, it was such a confusing situation. And I was very grateful for my representative that I got my Medicare supplemental program from, for her to walk me through it personally. And I think one of the things that I'm really lucky about for me is that I had those relationships. But I think there's a lot of things that you guys do that can help educate people, like how I was, that people may not know about. And that's certainly interesting. So obviously, original Medicare basically covers Part A, and Part B. But here's the thing: there's also a ceiling, or like a limitation. So, for example, I know when my mom went to rehab, after she had broke her pelvis, she went to a rehab center, and Medicare paid for like 6 weeks, and then she had a supplemental policy that paid for more. So there's advantages in that way, that it does cover, that's the supplemental side. What does Medicare Advantage go into that picture at that point?
That's absolutely right. Medicare Advantage also has out-of-pocket limits, which are a limit
Right.
on how much you would pay out of your own pocket towards your
Mhm.
own healthcare costs for the particular year. It's part of how they improve the financial stability of the people that they serve. These Medicare Advantage plans are offered by health insurance providers who compete for your business, and they are also accountable to the federal government. The federal government oversees the Medicare Advantage plans. They review these plans and the benefits to ensure they're offering additional value to seniors, that they're satisfying various regulations or requirements of what they should cover, and that they're a competitive value, so that when seniors are making a choice for their coverage, they have a lot of decisions they can make. What services do they want? What prescription drugs do they take that they want to make sure are covered? What are they comfortable paying for for their premiums? What are they comfortable paying for a deductible? Maybe they qualify for subsidies to help them afford these plans. So these are a lot of different factors that go into thinking about what's the choice that's right for you. Medicare supplement plans are another flavor of choice that people have. And to the point that you made earlier, there are many brokers who are certified in these plans, who get special education to make sure that they are informed, they know what these plans are, how they work, and they can consult with you to make sure that you're getting a plan that's best for your personal needs.
Well, and what I love about my Medicare Advantage plan is there's so many preventative type benefits. Could you share a little bit about those types of things that it covers?
Yes, and we find a lot of our seniors really appreciate these preventive services. These are services that help keep you healthy. It's the best way to think about them. So these would be things like your annual checkup with your doctor, who will check things like your medications, that will check your blood pressure, will check your blood sugars, will check your heart, to see if there's anything that it might indicate a problem that you can get ahead of and make sure that you treat early so that you don't become very sick. It also includes things like vaccines. And I know a lot of people, when we think about vaccines, we initially, think about COVID-19, which is very important. There are also flu vaccines. There are a lot of other vaccines that seniors may need.
Absolutely.
And these are covered as part of that preventive care services. What we find is that when we talk to our senior voters who have these plans, preventive services are one of the things that they're most satisfied with. When we talk to these, when we talk to these seniors, what we find is 94% of them are satisfied with their coverage. 93% of them would recommend them to their family and friends. And those preventive care services are a really important part of their satisfaction.
Yeah. It's really true. It's like, I was blown away. That was, I guess, the biggest surprise, because, I get like fresh, so many, so I think it's $75 worth of fresh produce every month on my policy. We get, silver sneakers where we get a benefit to participate in those types of fitness programs. There's all kinds of classes that we have the advantages to have, and I'm trying to think of some of the other ones, but I was amazed at how many things. And then the other part of it was when I got my hearing aids, bingo, I got everything for free. It was incredible. So Kristine, you and I are going to be back in our next segment, and we're going to talk a little bit about Medicare Advantage, who does it cover, and how is it accessible? How do we, access it? And we're going to talk also a little bit about demographics of the country, where we are in, across the U.S. And Kristine, you and I are going to be right back right after this. We at Answers for Elders thank you for listening. Did you know that you can discover hundreds of podcasts in our library on senior care? So visit our website and discover our decision guides that will help you also navigate decision making. Find us at answersforelders.com.